Hi, good evening. My name is Fatia. I'm going to be your nurse this evening. How are you doing?
I'm okay.
Okay, I'm going to go ahead and provide for privacy and then I'll wash my hands. Can you please confirm your first and last name for me
Yeah, calling on Faisal.
and your date of birth?
August 15, 1987.
Thank you. This video is being recorded in Ashburn, Virginia, United States on Friday, August 29, at 8:03 p.m. Kalyana, I'm going to perform a physical assessment on you. Okay. And before I proceed, I would like to take your vitals. I will start with your temperature. Temperature is 97.7, which is good. I am going to check your heart rate and your oxygen saturation. Okay. Oxygen saturation is 98% and your heart rate is 69. I'm going to go ahead and take your blood pressure. All right, can you give me your phone? Blood pressure is 110/70, which is within normal. So right now I am just inspecting your color. I'm inspecting your skin for any lesions, any wounds, um, or any discoloration or any abnormalities going on in your skin. So patient has taken off her gown, and I'm just inspecting the skin for any abnormalities. And skin doesn't have any discoloration or any wound or anything. I'm gonna go ahead and check for the temperature of your skin, and temperature is warm to touch. And then I'm gonna test for your hydration by testing for skin turgor, and it goes back really quick. That means you are not dehydrated. And then I'll just check for your circulation by doing capillary refill, and then it comes back really quick, less than 3 seconds. All right, so right now I am going to just inspect, start from the top here, and then I can see your head is evenly distributed, your ears is in midline, your nose is in midline, and I don't see any deformities or any abnormalities with your eyes or your mouth or your chin. Everything looks good with uh, um, in proportion to your skin color and your ethnicity. And then I'm going to have you to I'm going to have you occlude your nose, and this is me checking for airways, and breathe in and out, occlude the other one, in, out. All right, I am going to have you open your mouth, and I check with the pen light, and I see the uvula is in the right position. There is nothing in the throat obstructing any breathing, and I can see my patient is not there's no any nasal flaring or any sign um of breathing problems. So, Ms. Kaliana, can you tell me where you are? And this, I am going to assess your neurological status. Okay? Can you tell me where you are today?
Yeah, Ashburn, Virginia.
Thank you. Do you know who the president of America is?
Yeah, Donald Trump.
And do you know what today's date is?
August 29.
Okay. Patient is alert and oriented times 3. All right. So I'm gonna go ahead and check for your heart sounds. And before I do that, again, patient has taken off the gown even though she's wearing her clothes. I'm gonna listen to the heart sounds, and I'm listening to the rates, rhythm, and then the volume of the breath sounds in the heart. And looking at the heart, I don't see any abnormalities such as a battle chest. And also, she's not having any laboring. She's not having a laboring breathing. She's not using any of her accessory muscles to breathe, which is good. Okay, so I'm just explaining that you are not you don't have any breathing problems. Okay, so I'm gonna go ahead and listen to your heart. Okay. So listening to your heart, I am going to start listening to. I'm going to listen to. I will start with the aortic valve, where the aortic valve is, and then move to the pulmonic valve and listen. And then I'll come to the Erb's point and listen. And then I'll come to the tricuspid valve and listen. And then mitral valve here. And then I'm going to listen for the apical pulse here for full 1 minute. .72 beats per minute. Thank you. So I'm going to listen to your lungs. So when I listen to your heart, all the sounds, all the everything was within normal. I didn't hear any abnormalities going on. Okay. Now I'm going to listen to your lungs and see if there is anything abnormal going on in your lungs. Okay.
Okay.
And again, patient had taken off her gown, even though she's wearing her clothes. Taking a deep breath for me. Out, in, out, in, out, in, out, in, out, in, out, and out, in, and out. All right. I haven't heard any crackles or any wheezing. I haven't heard any abnormalities in the lungs. So the rhythm and the depth is within normal. I'm gonna have you turn your back, and I'll listen to the back of your lungs. Deep breath for me. Out, in, out, in, out, in, out, in, out, in, and out. All right, and the back side here, there is no any wheezing, there is no any crackles noted, and no any respiratory abnormalities noted in the lung fields. All right, can you please sit well for me? So I'm gonna have Miss Kaliana, I'm gonna have you lay down for me, and then I will listen to your bowels, okay? And before I listen to your bowels, do you have any pain?
A little bit.
A little bit. Where do you have the pain?
In my lower back.
Your lower back. From 0 to 10, how would you rate your pain?
About a 2.
2. 0 being no pain at all, 10 being the worst pain at all. So how would you rate your pain?
2.
A 2. When did the pain start?
Yesterday.
Yesterday. Are you able to describe the pain for me?
It's like a sharp stabbing pain.
Sharp stabbing pain. So what makes the pain better?
When I'm laying down.
And what makes the pain worse?
When I'm exercising.
All right. Thank you for answering my questions. And from the way my patient is asking, answering the questions, her speech is very clear. She's not in any distress. She's not anxious, and she's being cooperative at the moment. So I'm gonna go ahead and listen to your bowel sounds. By the way, when was your last bowel movement?
Yesterday evening.
Yesterday evening. All right. And today you haven't had any bowel movement yet?
Not yet. No,
Okay. And is that your normal?
that's normal.
Okay. Do you have any issues urinating?
No.
Okay, good. So my patient doesn't have any issues with bowel movement or urinating. I'm gonna go ahead and listen to your bowel for your bowel sounds, okay? And before I listen, I'm inspecting the stomach, and the skin color is normal. There's no any discoloration. There is no any ostomy. There is no distension noted here. I'm gonna go ahead and listen for the bowel sounds, and I'll start with the left lower quadrant. All right. So bowel sounds in all the four quadrants is normal. There's no any hyper or hypoactive bowel sounds. All right, and coming down, I'm still inspecting the down part. I'm still inspecting the lower part of her body and looking at the skin here is uniform to the rest of the body, and I'm gonna go ahead and touch the skin, and that is me touching for temperature, and then it's warm to touch just like the rest of the body, and I don't see any wound anywhere, and at this moment I don't have any equipment here, so I don't have to adjust any equipment, or there's no any dressing for me to change or take care of. So I'm gonna come down to the extremities, and when I come to the extremities, I'm checking for CMS, and that is I'm looking for the color, sensation, and motion. So with the color is the same as the rest of the body, and then sensation, I'm going to use the pen light to touch. You tell me if you feel any tickling sensation. Do you feel anything? Okay.
Yeah.
How about here?
Yeah.
So bilaterally, the feet has sensations in it. And then motion, can you wiggle your toes for me? My patient is able to wiggle her toes, so there is motion going, and I'm going to check for the peripheral pulses, and I'll start with dorsalis pedals. All right, and then there are pulses bilaterally, which is within normal. It's not bounding, and no shallow pulses. Now I'm gonna examine the posterior tibials. All right, there are pulses present in the posterior part of the leg as well. All right, thank you so much. So my patient was very cooperative with the assessment. Do you have any question for me?
No.
You don't have any questions? All right. And my patient doesn't have any questions. And at this point, I would like to end the physical assessment. Thank you so much.
Thank you.
You're welcome. And then I wash my hands.